Hi, guys, and welcome back to the Rare Wellness Podcast, the podcast designed to help you heal holistically and give you the tools that you need to thrive. We're making it easy to understand medicine and wellness with practical steps from the experts, one podcast at a time. The only thing that we ask is that if this podcast helps you live just a little bit better or a little more aligned, that you'll leave us a review and you'll share this with a friend. That's all we ask so that we can continue to provide you with free, valuable knowledge from the experts of well-being. This week, we are going to be looking into injuries, but narrowing down specifically into something that affects nearly half the population at some point in their lives, knee pain. We're going to be talking to a pain management and regenerative medicine physician on understanding what causes knee pain, the drastic impacts that it can have on quality of life based on the research, understanding the anatomy of the knee, different treatment options available out there. Our guest today is Dr. Lewis, who is board certified in physical medicine and rehabilitation and pain management, and he is the medical director of NWC4RM, the Northwest Center for Regenerative Medicine, where they use Regenexx to help people avoid surgery and heal their bodies naturally. Dr. Lewis is also the clinical assistant professor at WSU, the clinical faculty at Elson S. Floyd College of Medicine, clinical faculty at St. Luke's Physical Medicine and Rehabilitation Residency program. Dr. Lewis, welcome to the podcast. Thank you so much for making time out of your schedule to be here today.
Yeah, thanks for having me.
So I love to start every podcast by asking our guests, what does wellness mean to you?
Yeah, so wellness is kind of a term that I feel like gets overused sometimes. But, for me, wellness has to do with balance. So there's different, aspects of wellness. There's physical wellness, mental health wellness, your financial wellness. And I think in general, to be living a lifestyle of wellness is having all of these things in the perfect balance.
Absolutely. It takes like a holistic approach because if you're doing really well in one area and not in another, quality of life's not going to be there in the same way. So
Right.
For people listening to our podcast today who clicked on this episode, they've probably either experienced an injury or hoping to avoid experiencing an injury. We know that injuries can drastically impact someone's quality of life. So I know today we're going to be talking to you specifically about knee pain. How common is knee pain?
Well, knee pain is very common. It affects about 50% of adults will have some sort of episode with knee pain. It's more common in people over the age of 45, and it gets progressively more common the older we get. Females are generally affected a little bit more than men are. Worldwide, this affects about 650 million people. And then in the United States, we spend about $136 million a year for the treatment of knee symptoms or knee pathology.
I know I'm already a part of this statistic because I tore my ACL at 16. I've had numerous friends, athletes who've started experiencing knee pain so young, and it's everyone I know who's experienced knee pain. It changes your life. It's so hard afterwards to operate in the same way. What is the typical age range where people are seeing this injury?
Yeah, typically you're starting to see symptoms in your 40s, but again, young athletes potentially going to have issues earlier on in life, but around the age of 40, you start really starting to feel these early degenerative changes start to catch up with you. So, and then progressively as you get older, it's going to be more and more common.
So I know you mentioned women versus men earlier. Is there a difference between who experiences more knee pain?
So women are affected more commonly. That's likely because of just the anatomy of the body, where women have a little bit of a wider pelvis, and that puts a increased angle or Q angle on the knees and changes the tracking of the knee and can predispose women a little bit more for knee tracking problems. So they're a little bit overrepresented in the statistics.
What causes knee pain? What are the most typical ways that people get injured?
Okay, so that's a loaded question, but let's maybe take a little bit of a look at knee anatomy and then kind of circle back to that. How does that sound?
Perfect.
Okay, I'm going to share my screen with you. So just this big picture view of the skeleton and then kind of a close-up view of the knee and what that looks like. And as you look at the knee, this is the right knee. So this is lateral, this is medial. You can see that this isn't a very stable structure in of
Right.
itself. And so you've got to have some ligaments added on to kind of increase the stability. And then we can add in the muscle groups that can help provide a little bit more stability for this structure. If you kind of zoom in here, you can see, and this is the left knee here, so this is lateral, a couple of the main structures that are typically injured. So you've got on the lateral aspect of the knee, the lateral collateral ligament, on the medial aspect of the knee, the medial collateral ligament. And then you have this kind of crescent-shaped fibrocartilage here, which is the lateral and medial meniscus. And these are shock-absorbing structures that also provide a little bit of extra stability. Then if we flip the knee around posteriorly, you can see the PCL and the ACL ligament. And this is the one that you tore, I think you mentioned when you were 16. So these are the common ligaments and structures that are injured in trauma. So something happens and your knee twists or bends the wrong way.
The meniscus also, does it wear out with age? Some of that cushion?
Sure. Yeah. So all of the structures here are going to start kind of wearing out with age. Now the femur, you have the femoral condyles here that rest in this is called the tibial plateau, and they're surrounded by cartilage. And that cartilage, when you're young and healthy, is nice and thick, functions very well. As you get older, you start developing pits in the cartilage. You start getting cartilage loss. It becomes less functional. And that's kind of the process of knee osteoarthritis. The other bone here is the patella, and the patella kind of serves as a fulcrum that allows your quad muscles to really maximize their force in extending the knee. That glides in this groove here, and if you don't have good muscle balance in your thigh muscles, that can kind of rub up against the side of the femur, and you can get wear and tear of the undersurface of the cartilage of the patella, and that's called condylation patella. So that's kind of, anatomy of the knee. And so if we look at like what causes knee pain, we can kind of divide it into maybe 3 different categories. There's the sudden onset traumatic events, and those you can subdivide into those that, you get up and you can't walk afterwards, and you need to seek immediate medical care. And usually it's some sort of injury to one of these structures in there. A lot of times these require surgery, but now with modern technology of regenerative medicine and platelets and stem cell therapies, a lot of times surgery can be avoided even for those structures as long as you don't have complete rupture of these ligaments. Then you have the sudden onset injuries that you have sudden pain, but you can still kind of limp and walk, and these can potentially get better over the course of 6 weeks and don't necessarily require medical treatment. And then you have the very slow, gradual onset indolent pain syndrome. So it's just starting to notice your knee when you do certain activities. It becomes more and more noticeable over months to years. Start to notice you're starting to avoid activities because you anticipate maybe some discomfort, or because after doing certain activities, you're in pain for a few days later. And these are kind of the common, very slow growing issues that kind of start really wearing people down.
So before we dive deeper into these injuries, for our listeners, are there ways that you can prevent knee injuries from occurring in the first place?
Well, so, sometimes, just bad things happen to people, and you're in the wrong place in the wrong time. Or, if you're somebody who's really active into high impact sports, to have a bad fall, you might have, suffer a knee injury. And so, I wouldn't say, not engaging in those activities is necessarily recommended, but you understand that there's a certain amount of musculoskeletal risk when you're an adrenaline junkie and doing things like that. Otherwise, your body's ability to heal and repair from some sort of injury that you might sustain it is really kind of dependent on your overall body health. So anything that's limiting your body's health is going to limit your healing and repair. So if you have diabetes and your blood sugars are not well controlled, you're going to have a much poorer time healing. If you have some metabolic syndrome, you're overweight, have a low grade inflammatory response, some glucose intolerance and high blood pressure, you may not have any outward symptoms, but you're also not going to be functioning optimally. And then smoking, of course, drastically limits your body's healing and repair. If you have certain medications you might take, like steroids, can impact, which is kind of ironic because, a lot of times we use steroids to treat pain, but they actually can inhibit repair. And even non-steroidal anti-inflammatories, like over-the-counter medications, have a negative impact on your ability to heal and repair.
Today's podcast is brought to you by the Premium Center for Regenerative Medicine and Stem Cell Therapy in the Northwest Center for Regenerative Medicine. Get back to the activities that you love without needing surgery. You can book your appointment at nwc4rm.com. Again, that's nwc4rm.com. This podcast is also brought to you by Rare Wellness Supplements. You can head over to rareplanthealth.com to get your supplements. My personal favorite is the premium fish oil filled with omega-3s. Again, you can go to rareplanthealth.com and get the supplements that you most need to support your health and wellness today. Lastly, this podcast is also brought to you by Rare Wellness. Rare Wellness is located on the South Hill in Spokane and is one center that provides all the wellness tools that you could need. Whether you're looking for a hands-on, premium, intimate yoga studio with a therapeutic emphasis, bar classes, Tai Chi classes, if you're looking for skincare treatments, injectable, hydrofacial, microneedling, organic spa treatments, if you're wanting to get therapeutic massaged or book functional medicine appointments to get down to the root cause of your inflammation, Rare Wellness is the place for you. Whatever your wellness needs are, they have it covered. So to book your appointment today, go to rarewellness.com. Again, go to rarewellness.com and mention this podcast for 10% off when you're booking. Okay, time to get back to the episode. At what point do I need to come in and see a doctor? If I have been experiencing that third category of knee pain where you were saying it's more gradual and it's kind of bothering you, but you can still move, still do your activities, at what point do you need to seek medical attention?
Yeah, that's a great question. And we do know that people tend to wait too long. And what people tend to do is very slowly, gradually, they make compromises and what they're doing and between what they're doing and what they want to do, basically. So they start avoiding activities, and that is going to start taking a toll on mental health as well. You're not getting the enjoyment of your hobbies. You might have some decline in friendships because you're not out engaging with people because you're avoiding things because of pain.
Yeah, I definitely know for myself and a lot of other friends who have experienced knee pain or other types of injuries, it can be really hard if you're so used to living an active lifestyle and now you can't do these activities that you normally enjoy doing. For a lot of people, it's mentally debilitating as much as it is physically to sit still.
Right.
Yeah.
Yeah. And, cumulatively over the course of years, you might make some, really slow concessions to starting avoiding things that you want to do because of the pain. And then you end up after a few years with a very different life than you had, a number of years ago, and start having depression because you just don't have that social interaction, that physical outlet. A lot of people, if they knew that's where they were going to be, they would never, have allowed that to happen. But the slow, gradual progression kind of wears people down. I
think for a lot of people, they feel like they don't have options and they just kind of accept knee pain is something that comes with aging. Knee pain is something that comes with life. So what are some treatment options for people who are experiencing knee pain, from moderate knee pain early on to super severe surgery requiring?
Yeah, and I just want to build on that because I think sometimes people are afraid of the answer. So they think that the answer might be, a super invasive surgery, and they don't want that. And so they're just trying to live
I'd rather
with
not know.
Right. And slowly make, concessions on letting their activity levels slide. So yeah, if you read the textbooks on treating any kind of injury, there's this RICE acronym, which stands for rest, ice, compression, elevation.
Mm-hmm.
And so that's kind of the mainstay on something that happens that's acute, like a sprain or a strain, something that's probably going to get better. But, you give that a try for a few weeks. But certainly when you get to that 6-week mark and you're not noticing improvement or you're seeing continued worsening of your function, you should get evaluated.
Mm-hmm.
Treatment from there, typically physical therapy is kind of the first line. And really what physical therapy does is twofold. One, your body starts to compensate for an injury. And that compensation means your body starts to move in an abnormal way. And that abnormal movement has further deleterious effects on your body.
Mm-hmm.
And so you kind of get this snowball rolling down the hill effect where you have this initial injury and then you have more issues develop because your body's no longer moving in a normal way.
You have injuries from your injuries.
Right. And you can get this spread down the kinetic chain where, initially it hurt in one spot and now it's hurting in adjacent areas because of the way your body's compensating.
Do you see that a lot? Sorry.
Oh yeah. So the longer someone waits for evaluation and treatment, the more this is at play and kind of the bigger the issue becomes and the more impact on their activity it can happen. So physical therapy helps kind of restore normal kinesiology, kind of restore the normal way the body moves. And once you kind of get that normal movement, then you can build on that with strength.
So what are some of those like additional treatments? Like, I feel like for the average person, the only thing we really know is like it's PT or surgery.
Right.
What are the other options out there?
Well, traditionally, in medicine, we use steroids like a panacea. Like if it doesn't go away by itself, we throw steroids at it and hope that makes it disappear. And if it doesn't, then we go on to surgery. And steroids, can help people. And in a lot of times they can help person resolve the issue and they move on. But, the theory behind using steroids also doesn't necessarily make the most sense because as we stated earlier, steroids impair healing.
Yeah.
So what the steroids are actually doing is they're getting the inflammation down enough that your body can kind of move past it. Your body has home court advantage. I tell my residents using steroids is like using napalm. I mean, it's not good for anything, but hopefully since your body has home court advantage, when the steroid clears out of the way, the inflammation's gone and your body can help move forward.
Is there anything more are there any other more holistic options out there?
Yeah. So when we talk about kind of holistic care for, knee pain or any kind of, musculoskeletal injury, what resonates the most with me is regenerative medicine, because I feel like there's nothing more natural than using your body's own healing and repair system to help your body heal and repair itself.
Yeah. I feel like there's a lot of misinformation out there on regenerative medicine. Can you tell us a little bit more about regenerative medicine, platelets? How does this work? How does your body heal itself?
Yeah. So, kind of big picture, just because we're talking about knees, the issues that tend to not heal and repair that kind of stick with us are issues to the white tissues. So, the tendons, the ligaments, the cartilage, the meniscus. Muscle issues aren't very common, that they don't heal up on their own. And that's because, as you can see, that the muscles are red, they're highly vascular. And so you're able to get your body's healing and repair mechanism in there very easily. But these avascular tissues are very limited. And as we get older, they just tend to wear out. If you have an injury, they have a hard time healing and repairing. So to understand that, let's just take a look at what systems your body uses to heal and repair. And one of the main cells used in this process is platelets. Platelets do a ton of things in your body. They're like mobile pharmacies, and they're filled with all these different types of factors that do a variety of things. But with respect to your body's ability to maintain itself and heal and repair from an injury, there's growth factors and there's anti-inflammatory factors that are released. So your body has its own natural anti-inflammatory factors that it can put the inflammation out naturally. And then growth factors, which kind of like Miracle Grow for your garden, really helps support healing. One of the things that the growth factors do is they activate stem cells that you have dormant in your tissue. And when stem cells come online and be active, they can do a variety of things. They regulate inflammation further. They can also differentiate into different types of tissue, tendon, cartilage, ligament. However, this is mainly done in a lab. This used to be the mechanism that we thought worked in the body, but we now know probably the main mechanism they facilitate healing and repair is through intracellular communication, where they kind of direct the healing and repair process.
Yeah. So how do you use these cells? How do you activate these cells through treatment?
Yeah. So the big picture on regenerative medicine is, instead of giving up on your body's healing and repair mechanism, because it's been 6 weeks, it's been months, it's been years, and this hasn't gotten better, that we go after and we get these cells, and then using some sort of imaging guidance, we inject them back to areas where your body can't naturally get them.
What does that do for the healing process of the patient?
So you now have these cells available in an avascular area to kind of do what it normally does everywhere else in the body.
So that goes back to that white area that you were saying over time normally just doesn't heal itself. And now because we're injecting it, you're able to accelerate healing growth in those. You already said that.
We basically let your body do what it does in vascular areas.
Yeah.
In these avascular areas. So there's a little bit more science behind that. And so let's can we geek out a little bit more on the science?
Let's do it. Tell me about it.
Okay. So, we talk about platelets and stem cells. So platelets are probably, the most commonly used. And then more severe injuries would require the use of stem cells. But you can talk about platelets for a little bit. So using platelets, there's this term called PRP, which stands for platelet-rich plasma. The problem is that nobody agrees on what PRP is. So it should be, more platelets in PRP than there is in your blood for it to be rich, but how much more we don't really agree on. So there's a lot of literature out there that's all over the place because we don't really even have an agreement on what we're using. So the way PRP is generally made is a physician will buy a machine that kind of looks like this. There's a whole bunch of different ones out there. And you draw a fixed amount of blood, you put it in the machine, you hit a button, and 20 minutes later, ding, you get PRP. And it can look something like this up above. The problem is those machines are very, very different. And, one might, concentrate, only maybe not even 2 times the concentration of your blood. And so dose is important. We know dose is important.
So what does the science show? What dosage matters for healing and regeneration?
All along, we've kind of suspected that, obviously, like you take a Tylenol for a headache, full dose of Tylenol is 1,000 milligrams. If you were to take 5 milligrams of Tylenol, you're not going to get a response. And you can take another 5 milligrams, 4 hours later, you're still not going to get a response. So, the question has been, what is the platelet number that we need to get to be able to get relief? And so, in our system, we don't use a machine like that. We use the Regenexx system, and that's lab processed. We chose that system because even though it takes quite a bit longer to do, it takes like 3 hours to make our platelet products versus 20 minutes in a machine, we're going to get higher numbers. And so what that looks like is, let's take a look at a kind of recent research study looking at dose. This was published in Nature in 2021, looking at platelets with knee arthritis. And what they found was, if you can get a platelet count over 10 billion platelets, you get a much better outcome, up to a year more relief. So kind of 10 billion platelets is that magic number that we're kind of looking for.
So that's what you guys are aiming for in your laboratories at your practice.
Yeah. So our goal, because the literature, we see that studies above 5 billion platelets tend to have better results. But
Yeah.
this study is the level 1 that showed 10 billion kind of being the gold standard.
So how do you know that you have 10 billion platelets?
So this is a very good question, and there's a very expensive answer to that, and that has to do with you got to have a fairly complex lab, uh, and so this is our laboratory. This machine in particular is the hematology analyzer that we use, and this basically counts does a CBC. So I'm just going to show you some data from a patient we treated yesterday. So this is their CBC. It looks, a bunch of numbers there, but they're all pretty much within normal ranges. And then we take that blood and we process it, and we make something called SCP, or super concentrated platelets. It's a Regenexx proprietary PRP. And you can see that, the numbers are quite different. It still might look like a bunch of just boring numbers, but if we put it side to side here, you can see the platelet concentration in the whole blood is 193 times 10 to the third per microliter. But when we concentrate it to super concentrated platelets, we're 2,548 times 10 to the third.
That's crazy.
Microliter. Now, while we're doing that, we're also significantly decreasing the white cells. And the white cells are pro-inflammatory. And so if you concentrate the white cells too much, you can get a deleterious pro-inflammatory effect. So this is what's called a leukocyte poor PRP. So if we take the math on this, we have 2,548 times 10 to the third platelets per microliter. That's basically 2.5 million platelets per microliter. That's going to equal about 2.5 billion platelets per milliliter. And then you inject 4 cc's of that solution, and you've got above 10 billion platelets. And so when we're doing the procedure, we know that we're giving them an adequate dose to have a good outcome.
So if I'm listening to this podcast and I'm interested in regenerative medicine, what questions do I need to be asking the providers that I'm going to know if they're giving me the correct dosage?
Sure.
Do you have any guiding questions? Yeah, for people.
Yeah. So if you're looking at exploring regenerative medicine as a treatment option, one of the things you want to know is, one, is imaging guidance used to inject the product? Like, are you injecting it precisely, or are you just kind of willy-nilly just hoping for the best? And then, how are the platelets made? What are they making? If they can't give you like details about, how it's produced, and cell counts that they expect, then, you don't know what you're getting. Yeah. So they should be able to really define the type of product that they're making. It should be custom built for whatever your problem is. So that was for a knee. If you're treating a lateral epicondylitis or tennis elbow, it's going to be different. Word. Yeah. If you're treating your back, it's going to be different. Yeah. So it should be kind of customized for you.
So Dr. Lewis, since dosage matters so much in PRP treatment and regenerative medicine, do you think that's why there's so much like misinformation out there? Because what one person thinks they're getting a PRP treatment is not done on the same laboratory equipment, doesn't have the same volume. Do you think that contributes to some of the controversy in this field and on this topic?
Yeah, absolutely. I mean, if as physicians we can't even agree upon ourselves what PRP is, then what happens is we publish literature that can have vastly different outcomes. And when they're submitted to journals, the journals aren't looking at this to the degree of, well, what dose was given. They're looking at it, was it a sound scientific study? And if it was a sound scientific study, it gets published. So, there was recently an article published in JAMA that showed that it was completely ineffective. And they were using something that was pretty much the concentration of whole blood, but they were calling it PRP. And so then when insurance companies look at the data's, all over the place, because you've got some really well done studies on very poor dosing concentrations that show bad outcome. And then you've got other studies on good dosing concentrations that show good outcome. And so at the end of the day, that's why this is still firmly in the experimental investigational range, is because we don't agree. There's not a textbook.
So, Dr. Lewis, what are some of the outcomes from these treatments?
Yeah. So, outcomes is obviously a very important question. Since these are generally not covered by insurance, people are going to be investing their own resources into their health. And so you want to know, well, what kind of results can I expect? And so run clinics that are doing this scientifically are going to keep a registry, so you can have some at least registry data look at. I'll show you ours, and that's available.
Yeah.
If you go to our website, you can just go down to areas treated. We're talking about need a day. And as you scroll down, you see patient outcome data. And so this registry, going out has got, thousands of people in it, going out several years. And so we're seeing, overall functional improvement with, people with knee pain in the 70%. And so it's important to note here, this isn't a panacea. It's not going to work for everybody. There are people in here that have had no relief. There's people in here that have had 100% relief. But over the course of, thousands of people, this is kind of the relief we would expect to get.
But in reality, I feel like no medical treatment is guaranteed. Neither is surgery. There's plenty of people who have complications from it. And knowing that as a standard, when treated with the correct dosage, there is long-term relief, and to be able to keep your own body and keep your own ligaments and being able to experience that
you want to do.
100%. Yeah. No, it's incredible. Okay, so we like to end every episode with a practical tip for our listeners. So I'm assuming if someone's listened this far in, they're experiencing knee pain, they don't want to experience knee pain anymore, and they want relief. What is your practical tip for our listeners?
Yeah, so, this kind of goes back to one of your earlier questions, is when you get treatment. And I think when you get treatment is when it starts negatively impacting your life. And don't continue to make those slow, gradual concessions year over year, and wait to the point where you have more severe pathology, poor prognosis. Come in early and get evaluated and see if there's, potential treatment for you that can kind of get you back to living the life you want to live.
Yeah. Well, thank you so much for being on, Dr. Lewis. I feel like I learned a lot. I love talking to you. We'll have to do this again and look at different types of injuries and kind of go through the same thing. But thank you for taking your time to be on here.
Yeah, thanks for having me.
If this podcast episode helped you learn just a little bit more about your body, about healing, and living an optimal life, please leave us a review and be sure to share this podcast with a friend. That's all that we ask, so that we can continue to provide you free, valuable knowledge from the experts of well-being. Thank you guys so much for listening to this episode, and we'll see you next Friday. Bye.